today we're going to talk about POTS, Postural Orthostatic Tachycardia Syndrome, if I said that correctly. That's what I have ever since COVID. I've developed that. I've developed mast cell activation syndrome. Then 2 autoinflammatory diseases came out of nowhere, different from autoimmune. I made those separate videos in the link in the description. And among other things that I'm also not going to disclose publicly until those are, in fact, confirmed by my doctors. But it's a disorder of the autonomic nervous system, and that nervous system it's automatic, right? So it controls heart rate, blood pressure, digestion, and sweating. So normally what happens when you're sitting down or laying down, when you stand up, what gravity does is that it pulls 500 to 1,000 milliliters of blood to your legs and abdomen, right? This is just normal. That's what gravity does. And so your body detects that less blood is returning to the heart. And so that's when your autonomic nervous system kicks in. And within seconds, it tells your body to squeeze the blood vessels from the legs to pump the blood back towards the heart. And so in order for this to happen, it makes sense that the heart does have to beat slightly faster to do this. So that way the blood flow can get to the brain, right? And all is well, all is normal. But what happens in POTS is that for some reason, this mechanism, something goes wrong. And so too much blood pools, as they call it, to the lower body. And that causes less blood to return to the heart and to the brain. And so the heart has to beat much faster to compensate. I actually, in one of my shorts, you see that the heart rate just from standing up goes from 61 beats per minute and it shoots up to 117 beats per minute. And obviously with this, I'll talk about symptoms comes the lightheadedness, my legs feel 1,000 pounds and so on and so forth. I'll talk about that later or in a separate video. But in some patients, the heart rate works faster because the blood vessels don't properly squeeze. And then in other patients, the blood vessels do squeeze, but then the body produces too much adrenaline and then the heart rate goes up excessively. So that is actually called hyperadreneric POTS. I don't know if I said that. And it's like a subtype of POTS, about like 30 to 60%, as they say, in POTS patients have this. But most people, when they're diagnosed with POTS, aren't told what kind of subtype they are. So you definitely want to ask your cardiologist this, because the hyperadreneric form does have a slightly different treatment plan. So you should definitely ask your cardiologist on that. But I'm not a doctor. I'm a math teacher. Okay. So you should definitely ask your doctor. So the symptoms, the leg can feel like they're 1,000 pounds because of the blood pooling. Chronic pain can happen from this, racing heart, palpitations. I get all this, chest pains, dizziness, lightheadedness, nausea and abdominal pain, shortness of breath, abnormal sweating, brain fog, fatigue, blurry vision, feeling faint. Quite a lot of symptoms. And a lot of this also, a lot of POTS patients and mast cell activation or MCAS patients, which I have both. Definitely, if you have one, check for the other. I made video on mast cell activation syndrome separately, but a lot of them go hand in hand, especially with long COVID patients. POTS and MCAS are skyrocketing. It's crazy. So is POTS a heart problem? Usually not. The heart is often healthy, like mine is. It's just the problem, as I said, the mechanism, the blood vessel regulation and circulation, that is what goes wrong. But definitely, you could have other underlying heart conditions, but I put treatment in quotes because it's really just management. Supposedly, as of right now, there's no actual cure for POTS. So it's just a management plan, but who knows, I'm keeping my fingers crossed as technology, maybe AI can give some insight on, maybe helping people actually cure from this. So, increasing blood volume, reducing blood pooling, right? These are all of the goals. Improving circulation to the brain, reducing adrenaline surges, and then prevent what's called deconditioning. And so a lot of doctors tell you to drink more fluids. So you have to aim for about 3 liters daily, or 12 to 13 cups. Y'all heard me. Y'all read that correctly. A lot of doctors say to actually drink before getting out of bed. So I know a couple of people who actually leave electrolytes and like a water like on their nightstand. So they'll literally just drink it right before getting out of bed. And then eating hydrating foods. So you want to prevent fluid loss by limiting caffeine, limiting alcohol, avoiding excessive sugary drinks, and then avoid unnecessary diuretics. Like caffeine is a diuretic. So you might, that's important. So definitely limit that. And then a lot of doctors tell you to increase sodium intake. So just like over salting food, electrolytes, things like that. And that's because it helps you retain water, in other words, to prevent fluid loss. And then it also supports blood volume. And as I said before, like salty food electrolytes, even salt tablets. I haven't tried that yet. And as I said, I'm not a doctor, so just talk to your doctor. And then the reason why electrolytes do matter is because they have, sodium, magnesium, potassium, calcium, and they support hydration and circulation. And just these are like some key nutrients, and magnesium is what a lot of doctors recommend. Magnesium glycinate, citrate, taurate, check for vitamin D, iron, B12, folate, and then, deficiencies may worsen symptoms. So obviously making sure your blood work is all fine and dandy. Because I have mast cell activation syndrome, I really don't tolerate supplements. Like my body does like the opposite. So for example, magnesium actually gives me insomnia, and that's supposed to help you sleep. So that is why I made this YouTube channel, because I am a tough cookie to crack. So supposedly big meals can make POTS worse. Just, check with your body, see how you feel. But for some people, this is because blood shifts to digestion instead of focusing on, pumping the blood to your brain. It can worsen dizziness and fatigue in some people. So people say, or doctors say, to eat smaller protein-rich meals and to move lightly after meals. And then managing adrenaline surges. So deep breathing, meditation, avoiding nicotine and excess caffeine, and then having like a calming bedtime routine, limit screen time, all that stuff right before bed. And then a lot of doctors actually recommend, compression. So that's just because like compression socks, for example. But some doctors actually say like compression all the way up to the waist. So because this reduces the blood pooling in your legs, because that's also painful. So waist high are often most effective. So I am going to if you just Google lymphedema center, like near me, because they say also just like that is not really something that you should probably just blindly buy. You should really just get properly measured for that. And then for some patients, like all the way up to 30 to 40 mmHg may be recommended. So just check, just ask your doctor. But some people, like my legs really freaking hurt. So I'm going to the more extreme end of the spectrum. So sleep is super important, but what really stinks is that POTS can actually worsen sleep, or like a lot of people complain that when you wake up, you actually don't feel refreshed. That's like a common complaint. But so you need to prioritize sleep even more. So consistent bedtime, avoiding screens before bed, reducing nighttime stress or disturbances if you can. And then obviously, because sleep really supports everything. So there's like the POTS fatigue cycle that you get poorer sleep, and then you feel fatigued, and then feeling fatigued, then you get pain or brain fog, and then that makes stress worse. And so then you get worse sleep, and then you get more symptoms, and then it's just like a vicious spiral. I know that when I eat high histamine foods, because of the mast cell activation syndrome, I do notice that my POTS symptoms do get worse. So, and I'm making a separate videos on how I am trying to manage MCAS, and all of that. That's what I'm documenting on my journey. So more videos to come. And mental health is a big deal, like that a lot of people don't talk about. So anxiety and depression are common, yes, just from being chronically ill and getting frustrated in the medical community, because there's a lot of gaslighting going on, but then also from a physiological point of view, actually a lot of panic disorders people are getting misdiagnosed from POTS because of the whole like the heart palpitations and everything. And then, so a lot of people are, as I said, are getting misdiagnosed with like anxiety disorders and stuff. And then we just don't, I mean, that's at least what happens to me as well. I do also have an anxiety on top of that for sure. But I do notice, as I said, when I have high histamine foods, like I do notice I kind of start getting into like a panic mode. So it's just, I go on Facebook support groups, that helps me feel less alone, maybe checking out more channels like mine to just kind of make you feel like not like you're going crazy. I am an advocate for therapy. I go to weekly therapy that really helps me. And then, if you're going to work or if you're a student at school, just like talking to your teachers or talking to your boss and just telling them what's going on, because more often than not, like they do take that into consideration. So definitely speak up. Okay, so I'm making a separate video on exercise because a lot of people with POTS and MCAS too have what's called exercise intolerance. So pretty much, I want to be in bed all the time. I have exercise intolerance. So it's what's called the Goldilocks principle. So too little, you get deconditioning in your body, like your muscles get weaker or whatever, and that makes your POTS worse. Or if you exercise too much, too fast, you have your symptom flares as well. So I'm going to make a video on, how they tell you to wean into. There's a very specific protocol on how to wean into, like starting slowly. They say to like start anything, that obviously when you stand up, it makes your heart rate worse. So you're training your body. So you want to start with things that are more horizontal, for example, like swimming or biking or rowing first. So as I said, when I make that video, you'll see in the description on my journey to get back to like literally, I can't even stand up without feeling winded all the time. So I'm going to train my body to actually, be able to go for a walk for 10 minutes and not die. And then it's definitely worth mentioning that POTS, MCAS, and then what's called EDS, hypermobile, don't know how to say that, Ehlers-Danlos syndrome. If you're like super hypermobile and you have a lot of this stuff going on, because I know my immunologist told me to look for this, but I don't have it. But there is a lot of overlapping like symptoms. So you might have this. So because shared symptom of EDS also have fatigue and brain fog. So, just look into that. So in a nutshell, your management is hydration, making sure you have sodium and electrolytes, compression, better sleep, gradual exercise, and stress management. And that's honestly pretty much it, which stinks. There are some like medications that your cardiologist will like prescribe, like beta blockers or whatever it is to like keep your heart rate down. So that just depends on you. You have to ask your doctor about that. But just keep in mind, like to ask your cardiologist, because some medications I have read can make it, your POTS worse if you have like the more adrenaline type, the hyper, whatever it is. So I would just, I'll talk to your doctor about this. So I hope this was useful for you. Subscribe. And as I said, I'm documenting my journey. I have lots of stuff going on since COVID. And I'm hoping for this channel to help you feel less alone. And then also, just for you to see that it is possible. I am determined, even though really like most of the days, I feel like I want to give up. I want to show everybody that I can recover from this. And if I can, then so can you. I'll see you next time.